Today, in What's New in 22Q, we are diving into a really important study. It sheds light on how things we see in childhood might actually shape the long-term health and, psychiatric path for individuals living with 22q11 deletion syndrome.
It's such a vital area.
Yeah.
We know 22q11DS comes with this very high genetic risk for psychosis. Many adults do eventually develop a psychotic disorder.
Right.
But the big question, the one families and doctors always grapple with, is why? Why do some face these severe challenges while others don't seem to? This study gives us a kind of developmental map.
A map connecting behavior, body health, and even brain structure. It feels like connecting dots that maybe seemed separate before.
Exactly. It's a deep dive trying to link these puzzle pieces.
Okay, before we jump into assembling those pieces, let's make sure everyone knows the source we're talking about.
Good idea. So this is based on a really impressive long-term study. A huge collaborative effort led by Dr. Corrado Sandini and his colleagues. The paper's title is Chronic Early Life Obesity Linked to Childhood Impulsivity Predicts Long-Term Psychosis Trajectory Through Dose-Dependent Cerebellar Dysmaturation in 22q11.2 Deletion Syndrome.
That's quite a title.
It is, but it lays out the whole story. It was published just recently, 2025, in Biological Psychiatry, Cognitive Neuroscience, and Neuroimaging.
All right, let's unpack that. So our mission here is to really understand this proposed pathway, right? How childhood behaviors connect to metabolism, specifically BMI, and then how those two together might influence the risk of psychosis down the road.
Precisely. And the real strength here is the study design. They followed 184 people with 22q11DS plus healthy controls for years.
Wow.
Yeah, from childhood right into adulthood. Over 750 visits in total. That kind of long-term or longitudinal data is like gold.
Because you can see changes actually unfolding over time.
Exactly. You're not just looking at a snapshot, you're watching the movie.
So let's start with that metabolic picture. What did all those years of tracking show about weight trends?
Well, they saw a pretty clear difference emerge. Individuals with 22q11DS, on average, showed a BMI that increased more steeply starting in late childhood.
Okay.
This led to a higher average BMI by early adulthood compared to the control group. And they call this an atypical BMI trajectory.
And that divergence starting fairly early on, well, it's concerning. Did they look into why this might be happening in this group? And crucially, did they check if it was just, medication effects later on?
Yes, that's such a critical point. They specifically found this weight gain often started before any antipsychotic medications were used.
Ah, okay, so you can't just blame the meds.
Right. It suggests these metabolic shifts might be an earlier part of the syndrome's development itself, not just a treatment side effect, although meds can certainly contribute later.
That really shifts the perspective, doesn't it? Away from just medication management and back towards something more fundamental about the condition.
It does.
So if the genetic risk is sort of the starting point and the BMI increase is an outcome, what's the connection? What did the study suggest links those two?
This is where it gets really, really interesting. They pointed to a specific behavioral factor, impulsivity.
Impulsivity.
Yeah, the kind of behavioral and thinking impulsivity we often see in childhood. Things like hyperactivity, difficulty waiting your turn, acting without thinking. Symptoms often linked with ADHD based on parent and clinician ratings.
Okay, but how does being impulsive lead to gaining weight? What's the proposed link there?
Well, think about it. Impulsivity, these externalizing problems, as they're often called, could make it harder to stick to healthy routines, maybe lead to less structured eating habits, perhaps less consistent physical activity.
Makes sense.
And the study found something quite profound statistically. They found that these clinically significant externalizing problems actually fully mediated the link between having 22q11DS and developing these atypical BMI increases.
Okay, hold on. Mediated. Let's break that down for everyone listening. What does it mean practically if impulsivity mediated this?
It's a really key concept. It means the impulsivity wasn't just another problem happening alongside the weight gain. It was like the essential bridge or the mechanism.
Ah.
So having the 22q11 deletion didn't directly cause the atypical BMI on its own in this model. Instead, the deletion increased the likelihood of significant impulsivity.
Right.
And that impulsivity is what then drove the chronic weight gain trajectory. Without that bridge of impulsivity, the genetic risk didn't translate as strongly into the metabolic outcome.
So the behavior is kind of creating the physical conditions for the metabolic issue to take hold.
You can put it that way, yes.
And then this chronic high BMI, once it's established, links back to those long-term psychiatric risks we started with.
Exactly. That was the next major finding. Chronic exposure to this high BMI state especially if it started early in life, significantly predicted a much higher risk of eventually receiving a diagnosis of a full psychotic disorder.
And the difference in risk was pretty stark, wasn't it?
It was startling, really. In the group with sustained high BMI, the lifetime risk for a psychotic disorder was around 18%,
18%.
compared to just 4% in the group that maintained a lower BMI trajectory. Well, it's more than a four-fold increase, seemingly linked to this sustained metabolic status.
You really need to talk about this dose effect idea they mentioned, because it wasn't just about having a high BMI reading once, was it?
No, and this might be the most critical piece. The risk wasn't just about hitting a certain BMI number at age 18 or 20. It was about the duration. How long someone lived with that high BMI state.
Like a cumulative exposure.
Precisely. Think of it like chronic stress, maybe. A little bit now and then is manageable, but constant prolonged stress wears things down. Here, the prolonged dose of high BMI was linked to a progressive worsening of specific symptoms often seen in schizophrenia.
Which symptoms specifically?
Particularly symptoms related to disorganization. Things like bizarre thinking, jumbled thoughts, and also motor disturbances.
Okay, so we have the gene, the impulsivity, the chronic high BMI, the increased psychosis risk. Where does the brain itself fit in? Did they see physical changes?
Yes, this is where it all snaps together visually. They found that this prolonged high BMI status was specifically linked to progressive reductions in gray matter volume over time.
So actual shrinkage in parts of the brain.
Essentially, yes. Atrophy or a failure to develop typically. And it wasn't just anywhere in the brain. It was quite specific. The posterior inferior part of the cerebellum. Lobules the sixth and crust the first, to be precise.
Now, hang on. Cerebellum, most people think that's just for balance, for coordinating movement. Why would changes there affect something like disorganized thinking or psychosis risk?
That's a great question, and our understanding of the cerebellum has really evolved. Yes, it's crucial for motor control, but these specific posterior parts, especially crust and two, are heavily connected to brain regions involved in higher-level cognition.
Like thinking and planning.
Exactly. Thinking, planning, emotional regulation, language processing, filtering information. Kind of like the brain's quality control or fine-tuning system. So when the duration of high BMI led to volume loss in these critical cerebellar areas, that reduction then seemed to be the final link. It mediated the connection between the high BMI status and the worsening disorganization and negative symptoms related to psychosis.
Wow. So it's a complete loop. The gene increases vulnerability to impulsivity. The impulsivity drives chronic metabolic issues like high BMI. That chronic state seems to affect the development or health of the cerebellum, specifically cognitive areas. And that cerebellar change then increases the risk for disorganized thinking and psychosis.
That's the pathway the study maps out. It's clear, it's developmental, and importantly, it suggests potential points for intervention.
It really changes how we need to think about care, doesn't it? Mental health and physical health aren't separate tracks here.
Not at all. They seem deeply intertwined in this context.
Okay, so if that's the mechanism, let's talk practicalities. What does this mean for families, for caregivers? What are the key takeaways here?
I think the biggest takeaway is about reframing priorities. Managing impulsivity, those externalizing behaviors, it's not just about behavior management for school or home life anymore.
Right.
It needs to be seen as a critical way to protect metabolic health and, ultimately, protect the brain's development. Early intervention for these behaviors might actually help someone achieve a more typical neuroprotective BMI trajectory.
And didn't the study offer a specific point about treating impulsivity, something about medication?
They did, and this is potentially very significant for practice. They found that individuals who had high externalizing problems, but who received psychostimulant treatment.
Like the medications often used for ADHD.
Exactly. Those individuals actually showed a BMI trajectory that was more typical. Their BMI increase was delayed compared to similar kids who weren't treated.
That's powerful. It suggests that effectively treating the ADHD-like symptoms isn't just helping with focus or behavior in the moment.
It might actually be helping regulate the downstream metabolic risk. It supports the idea that these medications might be improving self-regulation skills, which then allows for healthier lifestyle choices. It's a strong argument for not undertreating significant impulsivity in childhood.
So addressing the behavior is key. What about tackling the metabolic side more directly? You emphasize that dose effect, the duration.
Right. That tells us we need to focus on sustained metabolic health, starting early, because it's the duration of high BMI that seems riskiest. Routine monitoring and proactive efforts to maintain a healthy BMI need to be part of the picture from childhood onwards.
And this isn't about crash diets or anything extreme, right?
No, absolutely not. It's about establishing sustainable, healthy habits,
Hmm.
good nutrition, regular physical activity, viewing these lifestyle factors as actual neuroprotective strategies.
Because the underlying mechanism might involve things like chronic low-grade inflammation, which we know is linked to obesity. So, a healthy lifestyle could be actively supporting brain maturation and reducing that long-term psychiatric risk. It's like personalized prevention through daily habits.
Well put. And one more small but important detail they noted related to comprehensive care.
Okay.
They saw a potentially higher rate of hypoparathyroidism, which is an endocrine issue affecting calcium, in the group that started with a high BMI early on.
Ah, another interconnected health issue common in 22q.
Exactly. It's just a reminder that we need to keep an eye on the whole picture. General endocrine health monitoring is also really important when thinking about metabolic risk in 22q11ds.
This is really helpful information, and this deep dive has been brought to you by 22q11 Europe, the European Association supporting families living with 22q11 Deletion Syndrome.
You know, if we really take this finding seriously, that sustained high BMI can cause these progressive brain changes that increase psychiatric risk, it opens up a whole new perspective on prevention, doesn't it?
How so?
Well, it poses the question, should early, maybe even aggressive metabolic screening and really targeted lifestyle support become just as standard as psychological check-ins for kids with 22q11ds? Could that become a core part of personalized care?
That's a really powerful thought. Shifting proactive care towards preventing these physical changes to protect long-term mental health. Lots to consider there.
Indeed.
Thank you for listening to What's New in 22q, produced by Dr. Stefan Ilias for 22q11 Europe. Take care and talk to you soon.